Welcome to Statesman Debate Institute's 10-minute tutorial for adults on domestic and world affairs. I'm Dr. Joe Arminio, Senior Instructor here at the Institute. From time to time, the high school and college debate competitions serve up amazing insights into domestic and world affairs. This is one of those times. I'm going to share with you several key insights derived from recent student debates that tackled the healthcare crisis. First are two shocking aspects of the proposed Medicare For All solution. Next, you will learn about an astonishingly promising solution that is just now appearing in policy circles. Finally, you will receive a handy comparison of the 6 major competing solutions to the healthcare crisis, including the respective Trump and Biden proposals. In September and October 2020, student debaters tackled the following resolution. The United States should enact the Medicare for All Act of 2019. The Institute, for its part, provided to the debaters what we call a classical topic analysis of this debate resolution. In the process of crafting this analysis, we made several startling discoveries. First, Medicare for All, if enacted, would categorically end religious liberty. Second, Medicare for All, if enacted, would most likely bring about a mandatory nationwide mental health screening system for youth and adults, with all that that may entail, both good and perhaps mischievous. Here is what we think is the most important of the discoveries, and it's about a very different way of solving the healthcare crisis. It's neither capitalistic nor socialistic nor a mix of the two. It's beyond what we, or outside of what we typically think as a solution. It's called distributism. It has medieval roots. Now you're going to tell me this sounds like a version of socialism. It's not. It's opposed to government control of the economy. It does favor private property. It promotes competition, but it has a way of dampening the emphasis that capitalism places upon profit making. It's called distributism because there's this diffusion of the ownership of production, of wealth generation. Now, specifically, the distributist solution to healthcare would have all the medical practitioners and dental practitioners forming into the 21st century equivalent of the medieval guilds. These guilds would compete with each other to attract and retain patients. In the process, those who are members of the guild would co-own the guild. They would co-own a part of the particular industry, in this case the healthcare industry. And this fifth discovery, the distributive solution, appears to us to be by far the best of all the major alternatives. Let's see why it is the best. Let's turn to the next slide. It's now time to do some comparative shopping. Let's compare the distributive solution to the much better known major alternatives, including also the present system. Well, this red stripe indicates the cost of the present healthcare system, which is a hybrid of public and private solutions. And the cost is just way too high, 18% of gross domestic product, $3.6 trillion this year. Well, the status quo, that is the present system, is expected to reach 20% of gross domestic product by 2030. This is a complete disaster, especially when you think about the national debt. This is what we're presently spending is 3 times more what we were spending in 1970, and it's twice more than the European per capita expenditure on healthcare. And what are we getting for this immense amount of money? Well, I'll tell you what 30 million Americans are not getting. 10% of the American population approximately is not covered. Now, the 90% of us who are covered, whether it be private or public, are receiving a quality of care which considerably exceeds the quality of care of what the Europeans are getting. And you'd have to think that that's a good thing, yet at what cost and how many Americans must be left behind? So along comes Senator Bernie Sanders' Medicare for All alternative, which, by the way, Senator Kamala Harris, Mr. Biden's running mate, has very strongly endorsed. Well, What they would like to do is provide coverage for all Americans, just like the Europeans do. They want to expand coverage too. Very ambitious. And they're saying that overall the quality of care will still be very, very high. In fact, they call it Medicare for All, that the high quality Medicare component that we now give to American citizens 65 years and older would be shared by all Americans plus extras. Can Mr. Sanders deliver on this? And at what cost? Well, he has been making people aware of a estimate which he thinks is right on the money. He says that over a 10-year period compared to the status quo, there'll be a savings of 10%. That's rather substantial. But the typical estimates say no, actually there'll be an increase of 7% compared to the status quo, and some say even higher, and quite a few say the quality will actually suffer very significantly. Mr. Sanders' response to this, oh, no, the government is the single payer. They are the single handler of all the monies. They're now being able to negotiate from a position of even greater strength. They can drive down drug prices, doctors' prices, insurance carrier fees. It can all be done. But one wonders. And also remember, the government would control the entire healthcare space with all that that entails, including possibly a mandatory mental health screening system. Now, there's another socialistic approach, which is to cleave very closely to the European socialistic model, which is about 9% of gross domestic product presently. Remember, though, we'd have to cover the 30 million Americans uncovered and provide these extra items. So we could move toward the total European cost, but not quite reach it, maybe 11, 12% of gross domestic product, but that's still substantial. Yet the quality of care surely would suffer compared to what we presently enjoy, what the 90% of Americans presently enjoy. There would seem to be no way around it. Now, how does Medicare for All and this other socialistic approach compare to the Trump and Biden approaches to health care? Well, I think you're going to see that Mr. Trump, Mr. Biden, by and large, are working at the margins of the present public component of healthcare. Presently, we're spending about 9% of gross domestic product on the public side of healthcare. In other words, the public side is consuming about half of what the total healthcare bill is. Well, Mr. Trump over 10 years would bring you down a bit to 8.5%. This is the public component, not the private, the public component. And Mr. Biden would increase the cost of the public component, but not by too much, to about 9.5% of gross domestic product. Mr. Biden would make up for his increase by taxing the rich. Mr. Trump would lower taxes on the middle class and hand off some of the burden to the states. In fact, he's already done some handing off and reaped some handsome savings. Mr. Trump's approach is a bit more capitalistic. Mr. Biden's a bit more socialistic. We should take a closer look at this effort to hand off to the states. This is the favorite Republican solution to problems. It certainly would weaken the federal government. Now, Mr. Biden wants to keep things at the federal level, and there's some advantages to that, of course, but ultimately he would keep the door open to Medicare for all. In fact, he has a public option that is giving someone who would otherwise be receiving private health care the option of buying into something like Medicare. So this is even a bridge to Medicare for all. Now, at the end of the day, Mr. Biden would say he's fixing what is wrong with Obamacare, and there's quite a few problems with Obamacare, and he's, in a very clever way, would reshuffle government subsidies to bring premiums down and so forth. Mr. Trump would say he's rolling back Obamacare, moving us closer to free market solutions, also lowering some drug costs and so forth. But as I say, at the end of the day, they both essentially are working the margins. We still would be spending huge amounts of money on the total health care bill, something still in this neighborhood. So how does the distributist solution compare to all this? Well, I think you're going to like it, though there is one deficiency in the distributist suggestion. It has been estimated that the distributist solution applied to healthcare would cost less than 1/2 of what we're presently spending. And this is remarkable. In other words, it would be even less than what the European socialistic model is calling for. The private sector would not only be maintained, the private sector in the healthcare space would actually be expanded. In fact, it would become coterminous. Essentially, those 21st century versions of the medieval guild are handling almost all the healthcare burden. They're almost doing it all. And there's that diffused ownership of these competing guilds. All Americans would be covered, and the quality of care, well, it would exceed the quality of care of any of the other alternatives, in fact, in some cases by a dramatic amount. I did say there was a deficiency with the distributist solution. Yes, that is, there has not been sufficient, at least to my liking, sufficient quantification of the healthcare costs and estimates. And why not? Well, not many people have been looking at this distributist solution, which raises the question, well, why not? Why haven't been more people looking at it? It seems to be very intriguing. Well, the reason for that, because we Americans, though we tend to be broad thinkers, yet still think inside a box, which tends to emphasize capitalism, capitalism has done a lot of tremendous things for this country, yet it also breeds crony capitalism. It tends to result in these monopolies popping up. This is resulting in significant, in fact, I would say more than significant frustrations. That's why a lot of people are entertaining socialism, of all things, moving in just the other direction altogether. I think it's high time that we take a look at distributism as well. Well, this concludes this approximately 10-minute long tutorial. I hope it made sense to you. More tutorials will be forthcoming. If you'd like to learn more about Statesman Debate Institute's assessment of the healthcare crisis, then click the link in the description box of this video and you'll be taken to our YouTube channel. In particular, it will take you to our classical topic analysis in full of the Medicare for All debate resolution. And we have other fine videos and briefings waiting for you. On the left of this slide, you can see a snapshot of Statesman Debate Institute's YouTube channel. If you'd like to be trained in classical forensics and learn how to attain the mountaintop view that famous world leaders attained, the mountaintop view of public policy, government affairs, and history, then click the link in the description box of this video and it will take you to our catalog of academic year programs. On the left-hand side of this slide, you can see a snapshot of that catalog. In this catalog, you will see a range of programs, including our nationwide online classically based debate league. There is nothing like it anywhere else in the country. We provide conventional debate training. We build upon that and provide classical debate training. You can see that we provide coaching in all manner of popular debate formats. We have our own version of government simulations, Model UN, Model Congress. We provide elite preparatory coaching for those going on to third-party Model UN conferences and Model Congress conferences. We offer AP history coaching, and last but not least, we provide BA, Master's, and PhD theses support.